I'm Zach and I'm a student physical therapist. Today I'm going to be looking at the scapulothoracic region, looking at different glides that we can do and also thoracic or scapulothoracic distraction. So the first thing we're going to do is put the patient's arm through ours so that way we can have access to the scapula. We're going to place the upper hand at the upper border, superior border, and the bottom hand at the inferior border. And from here, we can manipulate the scapula to do an upward or elevated glide, an inferior glide, protraction, and retraction. In addition, another movement that we can do aside from elevation, depression, protraction, and retraction is upward rotation and downward rotation, which really contributes to overhead reaching movements. So what you'll do is you'll again grab the upper and lower part of the scapula, and from here rotate upward, and then from here rotate downward. And from there we can also grab underneath to do distraction, so grabbing on the medial border, and from here pulling upward to assess for scapulothoracic mobility under the scapula. Now this is important because it'll help us to determine whether or not there is hypomobility or hypermobility in the scapular area that could contribute to different shoulder deficits, some of them being unable to reach overhead, so doing functional tasks. And if we're not able to do that or something is misaligned, then doing those specific techniques will alter that. The good thing about doing scapulothoracic mobilizations or glides is after assessing the mobility of the scapulothoracic region, we can turn that exact movement into treatment. So utilizing the movement up and down, in, out, as a way to increase the mobility of that region. What's good about assessing this too is that we can compare that to where the scapula normally rests in place. So looking if the superior border is aligned to T2, if the inferior border or the inferior angle is in line with T7, or if there's 3 to 4 finger widths from the spine to the medial border. And then from there, assess if there's any hypomobility, hypermobility based on that generalized placement of the scapula.